Today I'll be talking about my patient, George Areola, a 54-year-old Hispanic male, referred to nutrition services for management of hypertension and type 2 diabetes. For the nutrition assessment, several types of relevant data was collected. George is a 54-year-old Hispanic male who recently moved to the area and is establishing care with a new provider. His past medical history includes hypertension, type 2 diabetes, mellitus. He is currently prescribed metprolol-succinate 50 milligrams once daily and metformin 500 milligrams twice a day. Anthropometric data shows that George weighs 170 pounds and 69 inches tall, giving him a BMI of approximately 25.1, which classifies him as slightly overweight. Vital signs indicate consistent elevated blood pressure ranging from 166/92 to 171/96, suggesting uncontrolled hypertension. With his labs, they reveal fasting glucose of 120 milligrams per deciliter and a hemoglobin A1C of 61%, confirming suboptimal glucose control. His kidney labs include creatinine and BUN are within normal limits, and microalbum levels are within normal range as well, but require continued monitoring. Liver enzymes show a slightly elevated AST level, while hematology values include hemoglobin, hematocrit, and RBCs, and white blood count is all in normal limits. Social history indicates that George is currently unemployed, seeking labor work, lives with his girlfriend, denies smoking, and reports occasional alcohol use. Cultural background is Hispanic, which is important when considering cultural appropriate diet interventions. Based on collected data, the following nutrition diagnosis was identified: inconsistent adherence to a heart-healthy, carbohydrate-controlled diet related to limited nutrition knowledge, and inconsistent lifestyle habits as evidenced by elevated blood pressure readings ranging from 166 to 171 systolic, fasting glucose of 120 milligrams per deciliter, and hemoglobin A1C of 6.8% and a BMI of 25.1. This diagnosis prioritizes the need to improve dietary patterns to support blood pressure and blood glucose management. The nutrition intervention focuses on implementing a DASH-style dietary pattern combined with moderate carbohydrate control to address both hypertension and diabetes. The nutrition prescription includes increasing the intake of vegetables and fruits to at least 4 servings of vegetables and 3 servings of fruit daily, incorporating whole grains, and choosing lean protein sources such as poultry, fish, beans, and eggs. Sodium intake will be limited with no more than 2,300 milligrams per day, and sugary beverages and highly processed foods will be reduced. An on-screen nutrition infographic will be used to visually demonstrate the balanced meal method, showing half of the plate will be filled with vegetables, a quarter lean protein, and another quarter whole grain. And this visual will culturally appropriate food examples such as beans, corn, tortillas, grilled chicken, fresh salsa, and brown rice to improve understanding and adherence. Cultural competence is addressed by incorporating traditional Hispanic food into the meal plan rather than eliminating them. This approach supports healthy equity by ensuring that dietary recommendations are realistic and culturally respected and accessible based on the patient's socioeconomic situation and employment status. Short-term goals include reducing sodium intake and increasing vegetable intake, and improving meal consistency. Long-term goals would include improving blood pressure control, reducing hemoglobin A1C to below 7%, and achieving gradual weight stability. So progress will be monitored by using both the clinical and behavioral measures. Clinical monitoring would include regular measurement of blood pressure, fasting glucose levels, hemoglobin A1C every 3 months, and kidney functions. Behavioral monitoring would include food intake records, assessing adherence to the dietary recommendations, and monitoring weight change weekly. Follow-up appointments are recommended 4 to 2 weeks, initially with adjustments made based on progress towards nutrition goals. These monitoring strategies will help evaluate the effectiveness of the intervention to allow for timely modifications. In conclusion, George presents in an uncontrolled hypertension and suboptimal diabetes management, placing him in an increased cardiovascular risk. A culturally tailored DASH-style nutrition intervention combined with ongoing monitoring and education is recommended to improve his overall health outcome.